Hello, welcome back to Prostate Focus. This is the fifth video in this series dealing with my experiences of going through prostate investigations leading right up to diagnosis and further treatment and wherever else it leads. This video deals with my experiences of being sent for an MRI scan. An MRI scan means magnetic resonance image. It's a scan which shows up soft tissue and any abnormalities in that soft tissue. So essentially the people that sent me for an MRI scan are looking for growths of one sort or another on my prostate. It was taken in mid-December 2016, about 4 weeks after my first consultant appointment. MRI scans aren't unpleasant, but some people hate them. My previous experience is that if I just relax and maybe listen to some music that I've taken in, then it's all fine. Normally they are just noisy. There's quite a lot of banging as the magnets move around inside the tube, and you are in a closed tube. Although it's not claustrophobic, there's lots of fresh air passing over you. In this case, the MRI scan was a little more invasive. It was necessary to use some dyes in order to get to the areas that they needed to scan, and it was also needed to administer another drug, which I'll explain. But prior to the scan, I had to complete a fairly detailed questionnaire reconfirming the answers that I'd given in previous appointments. I was instructed to undress down to my underwear and wear a hospital gown. In preparation for the procedure, one lies on a fairly narrow bed because it goes into the tunnel. Sedation was offered, should I want it. I wasn't that bothered about sedation. I've had a number of MRI scans. I had asthma the day I went in and I was coughing just a little bit. That actually concerned me because if I coughed a lot, well, I'd move and the scan would have to start again. An intravenous line was inserted in the back of my hand. This is because the magnetic contrast material, as it's known, the dye as I called it earlier, gadolinium, is a substance which goes into the bloodstream and shows the blood flow around my body, and so they could see where the blood was going and where it wasn't going in and around my prostate. I was also given a fairly significant dose of a drug called Buscopan. Buscopan is used for quite a number of conditions. In this case, it was used to essentially immobilize my bowel movement. The bowel movement would have moved perhaps my bladder, my prostate, and it would have made it difficult to get a clear scan. Once I was suitably drugged up, the table was moved into the scanner. I was given earphones. I had an emergency button. It's not a huge amount of space, but you're not going to move anywhere, and so it's fine. I took a playlist of my own, which I could play through my music. As I said before, there is a degree of noise. There's also a degree of movement as the narrow bed is moved backwards and forwards as they get the pictures they need. And there's always contact through the earphones to the radiologist. They tell you exactly what's going to happen before it's happened and afterwards. The results go back to the urologist, and in about 10 days in the UK, one knows what the result of the MRI scan was. There's a couple of things to consider when having an MRI scan. If you have a large dose of Buscopan to stop the bowel movement, at some point that bowel movement must restart. In my case, I was on a Thursday afternoon when I had the Buscopan. My bowel movement did not restart all through Friday. It did not restart all through Saturday morning. It did restart with a vengeance at Saturday lunchtime. Now by this time I was almost 48 hours after the administration of the drug. By chance, I was 125 miles from home visiting my father and had just started to return home when the drug finally wore off, and it made for quite a difficult and uncomfortable journey, as you might imagine. I was planning my journey home by which large stores I could stop in order to use their bathrooms. This was not ideal, and if you're going to have Buscopan, I would seriously recommend that you don't plan any journeys too far away from home for a couple of days thereafter. That's the end of this MRI video. The letter that gave me the results showed what was called an area of interest, and that I would be referred for a biopsy in the near future. The next video will deal with that biopsy and the results thereof. So remember that Prostate Focus is only about recording my experiences in order that others may realize these are not difficult, and to encourage others to go for medical advice if they believe they have or loved ones have prostate difficulties. The site does not give medical advice. That's the job of a medical professional, and I urge you to see one if you believe you need. Thank you. The next video will be about the biopsy.